Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit my playlist. In the playlist I have provided almost all the topics in the systematic order. You can make use of it. Thank you very much. So we shall continue with the Ayurvedic approach of nephrotic syndrome. The minimal change in nephrotic syndrome versus Ojo Vyapat. In the last class we have tried to compare this immune aberrations with the Ojo Vyapat and Ojo Visramsa. Now, what do you mean by aberration of the Ojas? That is an exaggerated immune response causing damage to the own body cells is called as aberration of the Ojas. So we can find these two things in the context of Ojas, where he explains Ojo Vyapat and as well as Ojo Visramsa. We know that Ojas is the one Yannasho Niyatam Nashaha Yasmin Tishtati Tishtati. For the sustenance of the body, Ojas is very, very important. But if you look into the Ojo Kshaya symptoms, they are different. But whereas if you look into Ojo Vyapat and Visramsa symptoms, they are different. Now look at Ojo Vyapat symptoms. So we have Stabdha Gatrata, Stabdha Guru Gatrata, then Vata Shofa is there, Varna Beda is there, Glani is there, and Tandra is there. Now Stabdha refers to restricted body movements will be there, and stiffness and firmness will be there. So in this context of nephrotic syndrome, we can compare this with the generalized NSRK, which is giving this particular situation. Guru Gatrata, again consequences of edema and a heavy body will be there. Weight gain due to disturbed fat metabolism maybe, and collection of the fluids. Because of the edematous fluid, child may be having Guru Gatrata, or even because of a weight gain pattern which is disturbed because of the fat metabolism. So that may be the cause. Vata Shofa may be generalized pitting type of edema can be taken as Vata Shofa. Varna Beda, because of edema patient looks very glossy and shining look will be there, and chronic cases will always have anemia also, and isn't it? So iron deficiency anemia is there, so that may give the paleness. Therefore the word Varna Beda has been mentioned. Glani, discomfort, okay, and physically and psychologically child will have such type of discomfort which is mentioned as Glani. Tandra or Nidra, so these two things are compared with the altered state of consciousness which happens, that is Brahma, Tandra, etc. These do happens in nephrotic syndrome in the very chronic stage. So this particular explanation I have connected this with the nephrotic syndrome, minimal change nephrotic syndrome, but this particular thing will be seen in almost all the cases of the immunological disorders. Okay, wherever there is immunocompromised state, you find all these conditions. This is just an attempt to compare, that's all. Another attempt is to minimal change in nephrotic syndrome versus Ojo Visramsa. If you look into the symptoms of Ojo Visramsa, in the Ojo Visramsa he says Sandhi Vishlesha, okay, that is instability of the Sandhi, because Shlesha Kapha is get deranged, therefore this finding is there. Gatranam Sadhana due to protein loss, okay, so a lot of protein has been lost, so that leads, because proteins are the building blocks of the body, so protein has been lost, that leads to the Gatranam Sadhana, Durbalatva, etc. Then Dosha Chavana, disturbance of the equilibrium of the doshas, okay, there is abnormal movement of the doshas, Dosha Chavana, displacement, so there is a disturbance of the equilibrium of the doshas. Then Kriya Sannirodha, exercise intolerance, dyspnea, etc. will be there. So to some extent we can compare these two conditions, Ojo Visramsa and Ojo Vyapat, with the conditions of autoimmunity, or what you say, the minimal change nephrotic syndrome. Now actually we come to the next part. What is that Ojo Kshaya? Now Ojo Kshaya is different from this Ojo Vyapat and as well as Ojo Visramsa. Actually Ojo Kshaya occurs, that is a deficiency of the immune status, that is a immune deficiency status, okay. So here the treatment is nutritional supplements, okay. Once you provide the nutritional supplement, correct the lifestyle, select the psychology of the child, so Ojo Kshaya will be corrected. For all practical purpose, we usually compare the Ojas with the immunity. Example, in case of Rajakshma also, we say Shuddham Sattvam Atapicha, that means Ojasoho Vardito Ashvibhyam Shuddham Sattvam Apavicha, Shuddham Sattvam Taticha. That means Rajakshma, like an immune based disorder, is also get cured by increasing the Ojas. This is what Ashwini Devatas did to Raja Chandrama. Okay, this is Raja Yakshma of Raja Chandrama was cured by the Ashwini Devatas. What magic they did is they did Ojasoho Vardito Ashvibhyam Shuddham Sattvam Tatapicha. That means they just increase the Ojas. Therefore, we can see a direct relationship with this immunity and as well as Ojas, because we know that basically, although tuberculosis like conditions, so they are basically inflammatory condition, bacterial infection, but basically it is immunological condition, because T lymphocyte problems will be there. T lymphocytes fail to stop that particular infection in the pulmonary level, and that's the reason. Anyway, so when you look into the Ojo Kshaya, as explained in case of Raja Yakshma and all, it is immunocompromised state. So there are so many symptoms are explained. Okay, and so many causes are also there. Excess exercise, stress, as well as low calorific diet, then improper food habits, excess coitus, overworking, excess loss of kapha, and rakta and mala from the body. So these are the common cause for the Ojakshaya. Now, in a patient of nephrotic syndrome, Ojakshaya can occur, but Ojakshaya is not the pathology of nephrotic syndrome. Okay, Ojakshaya can occur after the use of the steroids. When the patient is continuously taking the steroids and comes to you as an Ayurvedic physician, you may receive him in a stage of Ojakshaya, because he is taking steroids since last 3-4 years, and as a result there is immunosuppression. He is taking some of the other anti-malignant drugs to suppress the immune system. So you can receive the patient in the stage of Ojakshaya. Okay, so pathology is not basic pathology of the nephrotic syndrome is not Ojakshaya. It is either Ojavyapata or Ojavisramsa. But here, the patient can come you in a stage of Ojakshaya. Okay, so this immunosuppression may be because of the drugs. Okay, so what the patient complained to you, that is generalized body weakness, malaise will be there, disturbed psychological status will be there, bad mental feelings, uncomfortable feeling will be there, murcha, mamsakshaya, moha, pralapa, marana, etc. So these are the drugs, these are the symptoms which is mentioned in Ayurveda in conditions of Ojakshaya. Now, when you receive the patient of nephrotic syndrome in this condition of Ojakshaya because of excess use of the drugs, now what treatment you have to give? You have to give for Jivaniya Aushadha. Okay, along with the routine treatment of nephrotic syndrome, you have to also give the treatment for Ojo Vardhana, because Ojakshaya condition is there, and Jivaniya Aushadhas, Kshira, Rasa, that is Mamsa Rasa, this should be given especially. Okay, so especially in steroid dependent status. In the condition is a steroid dependent and patient is taking more and more steroids and other immune suppressant drugs. So increase the immunity, you have to go for this medication. Now, involvement of the Ojas is obvious, but why? One thing is very clear: in a patient of a nephrotic syndrome, there is involvement of the Ojas, or involvement of the immune system is very, very clear. But even the contemporary science also don't know why it is happening. And when we discuss in terms of Ayurveda, we can find some solutions for the same, answers for the same. All the above explanations explained in the contemporary explanations point towards the fact that there is involvement of the immune factor or Ojas as a basic cause for this problem. And there is also involvement of the kapha. That is also clear by the explanation. They use the immunosuppression method to get relief from the symptoms, and also some other immunocompromising drugs. So overactivity and aberrations of the Ojas, overactivity of the immune system or aberration of the Ojas, or the hyperimmune reactions are obvious. But we should know what is the cause for that. What is the cause for that? That is very important. And they don't know the cause, therefore they told it as idiopathic, or they suspect immunity. But now in terms of Ayurveda, we should find a clear-cut cause for this immune exaggeration. So that explains the concept of Datvagni Mandya. So that we will see in the next class. Thank you very much.